Hi, welcome to the program today. We're glad you're with us, and I think today's program will be practical for maybe someone you know. Dr. Mills, I'm glad that you're with us as well. You're a dermatologist.
Yes.
And one of the things we were talking about is hair loss. You know, this is a troubling thing for some people more than others, and we need to talk about it. Do you see much of this in your practice?
Yes. In the childhood, we see sometimes, most common, we'll see a circle of complete hair loss.
Is that like from ringworm or something?
It can be, but often it's from the body's attacking the hair itself. And we call that alopecia areata. Alopecia simply means hair loss, and areata means an area. So we have to make it sound very difficult, alopecia areata, but that's what it means. Typically, that will respond to simple treatments, about 80% of the time. Some simple treatments will help it, but it can be progressive, and if it doesn't respond to steroid treatments,
you're going to lose hair.
Then you have hair loss in that area, but it's non-scarring. It doesn't have any scars, and typically you can cover it or hide it in some ways. Unless it becomes very extensive, then it's more of a problem.
Now, doesn't the hair, isn't it dead? Isn't what we see here dead? Or it seems to grow rapidly, but it's not really growing.
Well, hair is interesting. It is growing at different rates depending on whether it's a resting hair or whether it's an active hair.
So would these be active or resting?
Well, the hair you see is going to be active, but it grows to a certain length. Actually, it grows for a certain amount of time. Then it goes into a resting phase. So your hair doesn't keep growing and growing forever. It goes to a certain length, and then that's its length. And then it rests, just like every part of your body. You have a period of rest.
So let's say I'm losing hair, it's thinning. Is there anything I can do?
Well, it all depends. If it's in various patterns, you have to do some testing, some blood work to make sure that there's not thyroid or other types of disturbances. You want to make sure, particularly in a child, that it's not from a fungus. You want to make sure that there is nothing else going on. But if it's in a female and all of the tests are normal, then you look at the pattern, and many women don't know this, but just as there is a pattern for male balding, there is a pattern for female balding. And it thins. And if we give them Rogaine, Rogaine, you take that. If it helps, it will help in 2/3 of the people who take it. 1/3 of people, they don't respond to the Rogaine or minoxidil at all. But 2/3 will. 1/3 of the, or 1/2 of the group that respond, the hair will quit thinning.
Okay.
The other half of the responders, 1/3 of the people that use it, it'll actually begin to grow back. Some will grow back. So it's well worth it. However, if a person does use Rogaine, they have to use it forever. As soon as they stop, the loss will continue.
So that Rogaine just kind of is kind of like fertilizer.
You could think of it like a fertilizer. So that helps the male pattern or the female pattern of baldness.
So, you know, there are things that you can do is what I'm hearing, but what if none of those things work?
Well, there are wigs and there are surgical procedures, but that would need to be done by specialists, and it's probably outside the scope of our conversation here.
So there's hope, there's help if you're losing hair or someone that you know is having that hair loss, and things that you can do. Make an appointment with someone like yourself, and you can go through the options. And if you have more need of more information, go to our website, NEWSTART.com, and maybe we can give you a few more pointers there as well. Thanks for joining us, and thank you for joining us.